what seems to be everybody's favorite topic lately, and that's vaccine distribution in the region. And so we know that this is a topic of great interest and discussion over the past couple of days, and that discussion is a good thing for all of us to have because we all want to get a vaccine to as many people just as quickly as we can. And to do that, we have to get vaccine to people where they are. So right now, Missouri is receiving really anywhere, so you see that number 97,525, and so that number fluctuates a little bit. And the reason for that is because of the different amounts of vaccine that are coming in from different avenues. So we get the normal supply from the CDC through the federal government. And then you may have heard that the state is also pulling some doses from the federal program with the long-term care and nursing homes. And so those are doses that are coming from CVS and Walgreens. And so this number floats anywhere from 97,525 up to 111,000 doses per week. So it'll look a little bit different next week when we have this update. But as we've discussed before, these doses are then appropriated along highway patrol regions, and there's 9 of them here in the state. Now, St. Louis is in Region C, as you can see on the map there. And the population within Region C is around 37% of the state's total population. Now, we're expecting that the region will soon be receiving more doses, and we're really grateful that the vaccinators now will have some additional supply so that they can begin vaccinating more people. Now, currently, the biggest vaccinators in the region are the healthcare systems that I think everybody understands. And we've been receiving approximately 15,600 doses each week. And I know there's been some discussion about that number, but that's the number that's been made available to the task force healthcare systems in this region. And so we're using those 15,600 doses to vaccinate the eligible population through our healthcare systems. And we're working closely with our partners in the health departments, both in St. Louis City and St. Louis County and all of our surrounding counties, as well as our federally qualified healthcare centers, to make sure that we're getting vaccine to those priority groups. Now, the task force health systems have also given vaccine to many different entities, whether it's been local health or the FQHCs, and we've also contributed to vaccinating other groups that public health has asked us to do. So it's groups like law enforcement or first responders. You may remember it was about 2 weeks ago on NBC where they highlighted the effort going on down at SLU Hospital where we were vaccinating all of the law enforcement within St. Louis County, and that was close to 4,000 doses of getting our first responders vaccinated. And so it's been a great thing seeing us working together as a community to vaccinate those eligible populations, because we know that reaching herd immunity is really, it's a collective effort. It's not an individual effort, and I think everybody understands this. You know, you can't win a war by fighting on multiple separate fronts. You really have to have your resources be concentrated and then deliver really what is we call the mass effect in the military, and that's trying to get as much done with the resources that you have. But we have to work collectively. It has to be organized in order for this to work, and we'll continue to do that. And I want to thank all of our partners throughout Region C for contributing to this effort. A couple of things here now. So looking at the vaccine delivery channels. So as you can see here, we have a number of different channels that we're using to deliver vaccine. And you may see here that this is going forward. So the state has adjusted some of these doses going forward so that we're getting closer to that 37% of the population that I've talked about. And so you can see the doses going from that 15.6 to that 21,000 doses. Round 3 of that will be going to the St. Louis County Health Department. And then you can see the allotment also by the FQHCs, or the federally qualified healthcare centers, local public health, some other community providers, as well as some contribution from the National Guard, which is doing some mass vaccinations around the region. And that gets us up to a fairly significant amount. Now, we do think that there's going to be more vaccine coming online soon. We just don't know how soon. We're projecting probably March, April timeframe. And we don't know what's going to be the impact of the Johnson & Johnson vaccine coming online as well. But we suspect that it will, and that will be even more doses. And so that's all good news. So that's where we are on the vaccine delivery front. And like I said, it'll change a little bit here from week to week because of some of those doses that are coming back from CVS and Walgreens, but probably not terribly significantly. In looking at some of our doses that have been administered, so in total, we've administered around 256,000 doses. When you break that down by race now, you can still see that there's significantly, the population that's the highest is the white population. So these numbers haven't fluctuated very much from last week. Again, I think the main part of that is because it was going to healthcare workers originally. And some of these doses are some of those second doses that healthcare workers are receiving as well. So, but we don't want to skip over the idea or having equity within vaccine distribution, which is very important. And so we're going to continue to monitor these populations or these percentages going forward to make sure that they are accounting for the different populations in our community. Now, we're going to have to give it some time, though, to level out, to move away from that 1A population and starting to capture more of that 1B2 population. And so look for some more data for that as we're going forward.